Traumatic brain injury, neurobiology, and therapies. Traumatic brain injury is sudden damage to the brain, usually caused by a violent hit to the head. Meet John. He is a collegiate football star. At his game, he gets knocked to the ground with a hard hit to his helmet. He remains unconscious for a few minutes, and when he regains consciousness, he is disoriented, confused, severely nauseous, and has a severe headache. In addition, he loses control of his coordination and begins feeling tingling sensations and numbness in his extremities. John goes to the hospital and is seen by a neurologist. He gets a CT scan of his head that shows a small bleed or hematoma and slight swelling in the brain, edema. Let's take a closer look at what is happening inside his brain. There are many changes to the brain following a TBI. Today, I will focus on the changes of ionic environment and synaptic transmission. First, let's review how neurons usually communicate to each other. Neurons are known to communicate over long distances using action potentials. During an action potential, after the threshold level is met, the cell goes through depolarization. The voltage-gated sodium channels open, allowing sodium into the cell. During repolarization, the sodium channels become inactivated and no longer allows sodium to flow into the cell. The potassium channels open and potassium flows out of the cell. Then, the potassium channels close while the membrane returns to resting potential. Once an action potential is generated, it travels down the axons of neurons to reach the terminal where it triggers the release of neurotransmitters at the synapse, which send signals to another cell. One major excitatory neurotransmitter used by the brain is glutamate. After a hard blow to the head, the blood-brain barrier becomes weakened, allowing an increase in glutamate release. Glutamate acts on two different receptors called ionotropic receptors and metabotropic G-protein coupled receptors. Here we will focus on ionotropic receptors. Ionotropic receptors allow ions to flow into the cell and promote a signaling cascade. The two ionotropic receptors are NMDA and AMPA. When glutamate is released from the cell, it binds to both NMDA and AMPA receptors. Glutamate binding on AMPA depolarizes the membrane and kicks out the magnesium ion that is blocking the NMDA channel. This allows for passage of sodium and large amounts of calcium through the channel into the cell. Calcium acts as a second messenger that triggers signaling cascades. An increase in intracellular calcium triggers neuron death and impairs memory function. In addition, extracellular potassium accumulates outside of the cell. This has been shown to produce high levels of intracranial pressure on the brain. This graph highlights some of the ionic changes associated with TBI. The green line shows the dramatic increase in intracellular calcium and increase in extracellular potassium in blue following TBI. As seen on the graph in the orange line, there is an increase in cerebral glucose, followed by a longer period of cerebral glucose depletion. This disruption in glucose metabolism creates free radicals, which can cause DNA damage. The graph also shows reduced cerebral blood flow to the brain post-TBI indicated by the red line. Reduced blood flow to the brain, or ischemia, results in poor oxygenation of the brain tissue, also called hypoxia. Without proper oxygenation, the tissue begins to die. Serious consequences include infarction and stroke. Treatment depends on the severity of the brain injury. For an emergency TBI, blood clot removal, skull fracture repair, and relieving pressure inside the brain is of utmost importance. Possible therapies to combat ion imbalance include lactate, sodium pyruvate, and a ketogenic diet. Rehabilitation services such as physical therapy and occupational therapy are also available. In addition, certain medications can lower risks associated with TBI. These include anticoagulants or blood thinners, diuretics, muscle relaxants, and anticonvulsants or anti-seizure medications. Remember, each injury is unique and will therefore require a specific regimen of treatment. You can also do simple things such as always wearing your seatbelt, wearing a helmet and protective equipment, and never driving under the influence of alcohol and drugs.